We're at the University of Toledo Medical Center tonight, joined by Dr. David Sohn, and we're going to be talking about rotator cuffs. Now, I know there's a lot of myths out there. If you do ever tweak your rotator cuff and you do nothing and you just, sit on the sidelines, will it heal itself?
Actually, no. I mean, if you have a rotator cuff tear, the natural history is not for it to ever be able to heal, because the rotator cuff is a tendon that comes down onto the ball part of the shoulder ball and socket joint, such that when it fires, it helps you lift up your shoulder. Okay. Now, the misconception, though, is you don't have to necessarily operate on it just because it's torn. There's a lot of people who can learn to compensate for a rotator cuff using the other muscles of the shoulder.
But in the long term, is that hurting yourself more?
It could. Particularly if you have a painful rotator cuff. Our best evidence shows that if your rotator cuff tear is a painful one, that's evidence that that rotator cuff is actually enlarging. It's getting bigger. And
i.e. not getting any better.
Correct. It's not only getting better, but it's actually becoming bigger. And there is a critical size. After a certain point, the rotator cuff will not only withdraw from the bone, but it will start to atrophy and actually turn into fat. And after a certain point, it can become irreversible.
Okay, so it's something you need to stay on right away, and maybe not necessarily the surgery, but go in that direction. So what are you seeing when it comes to rotator cuffs? You're seeing an athlete. So you seeing it in everyday people with just normal movement?
I'd say actually by far more common than in the athlete, you will see rotator cuff tears, yes. And
just everyday natural things?
Yeah, particularly people who have to do overhead work a lot, people who work on assembly lines, people who are constantly shelving equipment. That puts a lot of stress on the rotator cuff. And over time they can develop small tears that then enlarge over time.
So if you feel a little bit of a tweak, don't just put a pack of ice on it. I mean, really watch it and watch your pain level, because it seems like pain level dictates the seriousness.
That's right. So what I would counsel people to do is to see your physician if you're having shoulder pain, not with an eye that you automatically need surgery, but to have it worked up and to see, is this something that can be managed with some physical therapy to retrain the other muscles, or is this something that's really better treated with surgery before it becomes irreversible?
All right, good information. Dr. David Sohn, we appreciate your time here at the University of Toledo Medical Center, and that is your Talk Back.